Hey everyone, it's Jonathan here alongside Lacey. Thanks for watching this Friday edition of This Is Now. You know, we got some developing news to get to. Mahealani Richardson had just spoke to the Lieutenant Governor regarding the coronavirus. Let's check out what she had to say. This is literally just filed minutes ago. She's got some new details about those cruise ship passengers from here that have now contracted the virus.
Aloha everyone, I'm Mahealani Richardson. I'm here with Lieutenant Governor Josh Green, who is also an emergency room physician. Lieutenant Governor, thank you so much for joining us. Now, I have spoken exclusively with a 70-year-old Hawaii man. He is from Honolulu. We're going to call him Dan.
Yes.
He was on that cruise with his wife and his mother-in-law.
Yes.
He is now in a Japan hospital recovering. He has been confirmed of having the coronavirus. You spoke with him yesterday, so did I.
Yes.
He said that he was at first getting symptoms of a red eye or a pink eye, and they were initially treating him with conjunctivitis. And then on February 8th, he was tested. February 11th, doctors told him he needed to pack his bags and get off the ship.
Yes.
You talked to Dan. What did he tell you?
He told me he felt quite sick for 3 days, like a heavy flu. His eyes were red. He felt terrible then and is feeling much better. Dan appears to be coming through this okay. He really seems like he had a heavy flu like we often have, but it happened to be coronavirus. He also told me that his wife and their other family member have not become sick, and to date anyway are not positive for coronavirus. So that's good news. That tells us also, once again, it's pretty difficult to transmit it until you're fully symptomatic. I'm not sure that that's enough reassurance for people out there, because nobody wants to get sick with this thing. But so far, it has been difficult to spread, and we haven't had any cases here. Now, I'm going to help chase down that one case that you're reporting on now. Then there is a couple other cases, right? There's another individual that's an elderly woman that was also on the ship that is quite ill. I would tell people this. Viruses like this, which can cause pneumonias, they are very dangerous for older people. The mortality rate, I was just talking to the CDC, is over 20% for people who are over 80 years old. So that's yet another reason that we don't want anyone to get exposure, and our elderly population, we have to really be careful not to expose. So there's a lot of moving parts to this. We're getting better information every day from the CDC. We'd like a little extra help because we want those tests here. I'm frustrated about that. They made a couple errors in getting us test kits that work, but we have not actually had to test anybody here yet in Hawaii, which is interesting. I don't think that that's going to last. I think we're going to be testing people in the coming weeks because more and more of these circumstances arise.
When I spoke to 70-year-old Dan yesterday, he was in great spirits. He was coughing a little bit. He said he did have a slight elevated fever, but he didn't have any complaints. He said he was being treated well. One thing that he did mention was that they believe that it was a passenger from China who transmitted the disease in the sauna area, and Dan believes that he got it from there.
Yeah.
So what can you say about that?
Well, you know, be careful taking saunas with strangers on cruise ships, I guess, because in this moment, there's a lot of vulnerability. The current problem is that that cruise ship has been incubating cases, and it was just bad luck for people to be on the cruise ship that also docked in China that allowed some of the infection to get on the ship. Right now, I haven't seen any cases. In fact, speaking of the Chinese community, I went down to Chinatown yesterday, and obviously there's no cases there, but people get afraid, and I understand that. We will have updates every day, if not every couple of days, on these cases specifically. We haven't seen a cluster. I'm even going to do some medical work this weekend to check in with our medical community, so I'm personally assessing it, and hopefully we will continue to have no cases in Hawaii and just a handful in the United States.
So Dan is on his road to recovery, maybe 4 or 5 days in the hospital. What have you told him in terms of when he does come back to Hawaii with his wife? Will he have to be quarantined again?
Pretty likely. We're going to get the official advice from the CDC. I did speak with our director of health, and I'll let him share the formal plans, but it's my expectation, because there are unknowns about this virus, that people should at least do home observation for 2 weeks after having the disease. Now, what's being done is, if you are sick with coronavirus like this gentleman is, he told me he will have to get 2, and this is correct, 2 consecutive days of negative tests, which means that a virus is dead, it's out of your body. At that point, he is not a risk or infectious. However, Every virus can be different. I don't know if these viruses could possibly have recurrences. He told me he intends to recover in Japan, where his family has a home for some time, so it might be a moot point in his case. But there will be many other cases where we'll have to decide, do the other individuals come back to Hawaii, and how safe do we have to be? I say be conservative and make sure people are at least in home quarantine. And if there's any inkling of them still being sick, they have to be, of course, in mandatory quarantine or in healthcare. They would have to be in a hospital.
And he said he's not taking any, or they're not giving him any special medications. They're just letting him ride this out.
Yeah, what you have to do with these kind of things is you have to keep fever down and keep hydrated, and you get respiratory help like oxygen or, God forbid, a ventilator if you are having respiratory collapse. These antivirals, we don't know if they do anything. We don't usually give much medicine for people with basic viruses. Like, there's no treatment for the common cold. We do give medication sometimes for the flu. As you know, if you catch it in the first 36 hours, we give people 75 milligrams twice a day of Tamiflu. And that has been suggested it shortens the flu by 1 day. I don't even know if it helps. I don't prescribe it typically because I don't really think it helps very much. People do have to ride it out. Most importantly, everyone should get their flu shot, wash their hands. You guys are getting bored of hearing that, but that's the right thing to know. And we will keep alerting people on all the info we've got on the coronavirus.
And finally, Lieutenant Governor, let's talk about the testing kits for the coronavirus that came to Hawaii, botched,
Yes.
literally.
Yes.
What's going to be the latest in terms of those testing kits coming to Hawaii?
Well, I gave the CDC some grief just an hour ago. I'm pretty mad about that. They sent them to the wrong state, then they sent us broken ones, and they sent us ones with the reagents not working. And that was the case with many states across the country. They messed that up. They know it, and they're going to have to own that. By next week, I want us to be testing people. In fact, I wanted to be testing people last week. When I'm on call this weekend, though it's not going to be on Oahu, I would have appreciated the ability to do some screening when necessary. Now, we can still test people, but we have to send it to Atlanta, which takes about a week to get the results, and great. That's too long. So we're pressing them, and they're looking at this as an emergency, but believe me, the big emergency still in Hubei province.
Lieutenant Governor Josh Green, thank you so much for your insights, and thank you for joining us today.
All right, thank you, Mahea, and Lieutenant Governor Green there for that report. You know what, we've just learned there's going to be a press conference regarding all of this that's coming up from the Department of Health. We're expecting that in about 10 minutes. We'll bring it to you live as soon as it does happen. Meantime, let's get to some other updates regarding that cruise ship.
More than 3,700 passengers on that cruise ship that Mahealani was talking about. They have been in quarantine since early February, docked at the port city of Yokohama. It became a floating quarantine zone after dozens of people on board tested positive for the novel coronavirus. At least 6 other passengers are believed to be from Hawaii, and we're learning a little bit more about those passengers.
Yeah, they were just talking about it there, and I pulled that sound that Mahea was talking about, that interview she did with the one resident. We're calling him Dan. He lives here in town. Let's listen in to what he had to say. It really gives a first-hand account to what folks are dealing with there in Japan.
It's like having a cold, except I've never had cold that, manifested itself in different parts of my body like the way it does. It just sort of it's kind of attacks different area, but it comes and goes. I've never got the headache. Some people get headaches, but I never got the headaches. I just got a little cough and temperature. That's been basically my body's reaction. Well, we were supposed to get off the ship on the 4th, so quarantine started like on the 3rd. They didn't tell us, but 3rd was the beginning of the ship's quarantine, and then I am now on the ship. In the hospital in a quarantine starting from the 11th. Well, once I left the ship, the hospital here is treating me, really nice. Nurses, they're all wearing the full hazmat gear. I can't even see their faces, so I can see their eyeballs with their mask.
All right, that was Dan there, one of those who have contracted the virus on the cruise ship off Japan. CNN spoke to another passenger on board. He actually has 10 family members. Dan there also has remaining family members that are passengers on that cruise ship that have not contracted the virus. But this person in the CNN report has 10 family members on board that ship. So let's check in with Will Ripley for that report.
All right, 1, 2, 3, go! This is what a cruise is supposed to be like. For parents with young children on the Diamond Princess, this only happens for about an hour every few days.
Oink, oink.
All those other hours are spent like this, waiting for the daily delivery of fresh toys, coloring books, crayons, colorful beads.
I have this bracelet and also this one.
Arts and crafts can keep the kids busy for hours. Every morning, local jet skiers try to boost morale.
No!
Every evening, bunk beds become trampolines.
Being trapped in this cabin, it makes you think and realize we should appreciate the little moments, the little details of life.
Harvey is a young dad who asked us not to use his last name. He's on the quarantine cruise ship with his entire family.
There's 11 of us, and then there's 5 kids.
The youngest, 3. The oldest, 8.
What do you tell your children about why you guys are sitting there for this long?
We say there's this invisible monster called the coronavirus, and we can't go outside.
That invisible monster may have the parents more spooked than their kids. Nobody in Harvey's family is showing any symptoms of novel coronavirus. He thinks they should all be tested anyway.
The numbers are kind of strange to me. I'm also worried because even though I trust my own health, I don't want to be an invisible carrier.
The Japanese government has only tested a few hundred people out of more than 3,000 on the Diamond Princess. Many are asking, why not test everyone at once? Japan can only process around 300 test kits per day. The nation expects to more than triple its capacity by early next week, one day before the end of the quarantine. The question many are asking, is it too little, too late?
If we are worried that we might be carrying, then it will affect our daily life when we go back. That's one of the major concern, that we don't want to be carrying it, and then we don't want to spread it to communities.
Harvey worries what could happen when they go back home to Hong Kong. Could he and his children be stigmatized? Could they pass the virus to their neighbors, family, and friends? Peace of mind, he says, can only come if everyone on board is tested, and if those tests come back negative. Will Ripley, CNN, Yokohama, Japan.
The coronavirus outbreak in China is growing by thousands of cases a day, while the CDC says 15 people in the U.S. have now contracted the illness. This morning, Chinese officials say they've confirmed around 64,000 people have gotten sick and roughly 1,400 have died. Carter Evans is tracking the worldwide response to the outbreak.
More medical teams arrived in China's hard-hit Hubei province Thursday as officials confirmed roughly 1,700 health workers have been infected by coronavirus and 6 have died. Meanwhile, after the Japanese government reported its country's first coronavirus death, Prime Minister Shinzo Abe vowed to ensure the safety of this summer's Tokyo Olympics. In Cambodia, that country's prime minister greeted passengers of a cruise liner that began its trip last month.
Thank you.
They were finally allowed to disembark after several countries turned them away, even though there were no confirmed cases of coronavirus on board.
We're very, very pleased to be in your country. It's good to step on land.
The risk to the San Antonio public remains low.
And in the U.S., officials in Texas confirmed the 15th domestic case of the disease. One of the evacuees from Wuhan to arrive at Lackland Air Force Base last week is now being treated at this hospital.
The risk is low for the American people, but that could change.
Dr. Anthony Fauci with the National Institutes of Health specializes in prevention of infectious diseases.
The message is stay calm, don't get frightened, and let it influence your life right now.
UCSG Health is currently treating 2 coronavirus patients and a third is under investigation. Meanwhile, there's a pharmaceutical company here in San Diego called Inovio. It's one of several companies across the country that's working on a vaccine. This particular vaccine has already been tested on animals. It goes to human trials early this summer. Carter Evans, CBS News, San Diego.
All right, Carter, thanks for that report. And again, we are expecting a press conference here in just minutes. I'm watching them set up right now from the Department of Health. They're going to update us more on how the local state response is going in dealing with this virus. Again, that's going to come up in just minutes. Probably going to have our usual players there, the Director of Health, Sarah Park. She's been a frequent face of this crisis that's going on across the globe. Again, we'll bring you an update, that press conference live as soon as they set up. Again, I'm watching them. Should be in just minutes here. But in the meantime, let's get to some other news.
Honolulu police want to question 2 men spotted fleeing the scene of a shooting in Makiki. Bullets started flying around 11 yesterday morning in a parking lot behind businesses at the corner of Pensacola and Yonge Streets. Fortunately, no one was hit by gunfire, but a 1-year-old baby and an adult were both cut by flying glass. The Lexus was empty, but police confirmed there were 5 people inside the black SUV right next to it. HPD says if you see those persons of interest, do not approach them, just call 911.
All right, coming up tonight on KHNL, there's a Dateline special investigation. It's 2 hours long. If you've been following this case of those missing Idaho kids, you're going to want to watch this. Let's get a little preview of what's going to happen tonight from Keith Morrison from Dateline.
How strange it was. Such a dark story, and yet here they were in a kind of Eden. Under the Kauai sun. A Dateline investigation, a trek across 5 states and more than 5,000 miles. But we found them. So that finally, we could ask them the question.
What do you guys have to say to the people who are looking for your kids?
The question. Where are the children? Their names are Chad and Lori Daybell. The missing kids, Lori's kids, are JJ and Tylee.
New details continue to come to light in the case of 2 missing children.
The latest chapter in this Dateline-like mystery.
A bizarre mystery in Idaho where a frantic search is on for 2 missing siblings.
And yes, these are the people behind all those headlines. In their wake, those 2 missing children, 2 dead spouses, and a dead brother. Oh, and their prediction that the world is going to end in just a little less than 5 months from today. We'll tell you later how we found them, along with something no one has heard until tonight. That is the whole unbelievable story, a mystery unlike anything we've ever seen. Buckle up. It's going to be a wild ride.
That's coming up tonight on Dateline here on KHNL. That story looks really intense, right?
So many unanswered questions, and we just want to know where the kids are, and there's just even the added deaths in that with the spouses. I definitely want to watch that.
Yeah, I've been following that one closely. I actually went to the Garden Island with Ashley when we were trying to track them down as well. Dateline actually had luck tracking them down. You'll see that again tonight on KHNL. In the meantime, let's get you outside. Let's get you a check of the weather. It's looking pretty nice out there. It's been an unusually cool week or so, right?
A little more sunny.
Let's see what it's going to be like this weekend. Here is our good friend, hopefully with some good news.
Come on, Guy.
Aloha on this Valentine's Day. I'm Guy Huggy with your HawaiiNewsNow.com forecast. That disturbance that brought the snow and the heavy rain, heavy winds to the Big Island and Maui summits is now pulling away to the west. We're going to see some leftover showers for those windward and Mauka areas, but really no significant rainfall is expected anytime soon. If anything, we'll see some windward and Mauka showers in the overnight and early morning hours for the next several days. And the winds will be picking up. They're not all that strong just yet, but it's still early. We're expecting them to rise to about 15 to 25 miles an hour today and through the weekend, and even getting stronger parts of next week. So for today, with all the sunshine, temperatures will be running into the low 80s. And on Monday, there's going to be great conditions for the Great Aloha Run. Breezy trade winds, a few minor splashes, partly cloudy skies. Good luck to all the runners. And then starting tomorrow for the west side out at Makaha is Buffalo's Big Board Surfing Classic. They'll get some good waves because north and west shores will see a rising swell by tomorrow afternoon. South shore is going to get a pulse as well, but for today, it's going to be running about 1 to 3 feet. And the high surf advisory has been tossed out. East swells are choppy, 4 to 7 feet. Keep it here on Hawaii News Now. We love all your severe weather updates.
Decent Valentine's
Yeah.
Day gift from Guy there. Happy Valentine's Day.
Happy Valentine's Day, Jonathan.
Making me blush.
Well, speaking of Valentine's Day and love in the air, marriage proposals are always popular on this day. But it's not just men getting down on one knee. Hillary Lane sat down with a couple who added a new twist to an old tradition.
Sarah Sika and Ramiro Flores are both teachers. When they first met at a school in 2014, they quickly got a course in chemistry.
We saw each other across the room and we both felt something.
After dating a few years, Ramiro proposed. Sarah accepted. that's usually the end of the story. But a year later, Sarah got down on one knee and asked Ramiro to marry her.
And it was crazy because we were already engaged, but I was so nervous to do it. Just thinking about what I'd say to him. It was like, is he going to say yes?
It was perfect. I can't even describe the emotions I felt and still do.
She even surprised him with an engagement ring that matched the one he had given her.
It felt like my way of reaffirming that I wasn't just passively saying yes to his proposal, that I truly was committed to him.
Sarah isn't alone. Skier Lindsey Vonn made headlines on Christmas when she asked her fiancé to marry her, writing on social media that men should get engagement rings too. And a 2018 report from Pinterest found the number of people searching for women proposing to men ideas skyrocketed 336% from the year before. Professional matchmaker Michelle Frankel says the trend is all about gender equality.
If a woman wants something, she goes after it in the workplace. She wants to live her life with a man. Why wouldn't she choose to go after that and propose?
For Sarah and Ramiro, it's an experience they'll treasure forever.
His eyes were welling up with tears, and I could just see in his face that he knew in that moment just how deeply I loved him.
The couple looks forward to many more special moments as they spend the rest of their lives together. Hillary Lane, CBS News, New York.
All right, let's get to some more V-Day news.
V-Day, you got the roses, the chocolates, the dinner reservations. Now, those are all essentials for Valentine's Day. And don't underestimate the importance of the greeting card. According to the Greeting Card Association and Hallmark, roughly 145 million Valentine's Day cards are exchanged each year. That makes Valentine's Day the year's second largest card-sending holiday, right behind Christmas. Now, according to the History Channel, the tradition of exchanging tokens of affection on Valentine's Day goes back centuries. People in the U.S. likely started giving handmade valentines in the early 1700s. America's first mass-produced valentines showed up in the 1840s. They were elaborate creations sold by Esther Holland, known as the mother of Valentine.
Oh, good history lesson there. Something's changed for Valentine's Day for me over the years. I don't know if you've noticed this, but when you were a kid, when you went to school, you put something on your desk, right?
Yeah.
It was like this, like
a simple bag.
A simple bag, right? A simple bag. Well, that's all changed, because I don't know if you've seen these intricate Valentine's Day boxes that people are making.
Oh my gosh.
Look at this. Okay, I actually pulled this off my friend's Facebook feed. That's my friend Michelle's niece and daughter there. They made a little reindeer or deer Valentine's Day box. People are going all out here.
I am slacking.
And then this was actually a news director friend of mine. Their newsroom made these boxes. We see R2-D2 there. We see the Little Mermaid. And then look up in the right-hand corner. They made a box.
Breaking news.
A little news vehicle. And then we got the traditional heart cut out there. Now, this next one I found on my Facebook feed is hilarious. This was on my friend Mandy. This is from her middle child made this. Keep this in mind. It's the middle child syndrome, she says. She was only going to give him a bag. She wasn't going to spend a lot of money. And so she gave him a bag, or he could go find anything he wanted to make his box. He came up with this. A Valentine's Day box toilet. So you can see how he's feeling about the holiday, I think. I literally laughed out loud when I saw it. And he even wrote a little note on there. It says, "Do not touch the plunger." He drew like a little cartoon plunger there.
Max toilet only.
Yeah, well, at least it's keeping it sanitary there. Yeah.
Maybe it's definitely different.
Definitely different. I don't know. I would love to see. Next year we'll make boxes.
I know, I'm slacking.
And no one in the newsroom even gives Valentine's.
You know what? We're going to change that next year. We're going to up our Valentine's game in 2021.
Let's share the love. I need more love in that newsroom. All right, Melania's up to stuff this morning, celebrating Valentine's Day in her own way.
Yes, she visited the Children's Inn at National Institutes of Health in Maryland. This is the third year the First Lady has visited with children at NIH on Valentine's Day. Children's Inn allows seriously ill children and their families to stay free of charge while they participate in research studies. The First Lady made Valentine's themed arts and crafts with young patients and visited with their families. Mrs. Trump also received a bouquet of roses and picture frame with cutout hearts from the children.
A very cool outfit there too.
Yeah, I love
Valentine's Day red.
The reds and the pinks.
Yes. That's having fun there. I want to do some craft projects too. I guess
I know.
Maybe I shouldn't have knocked the box too much, but oh, she got some roses.
Beautiful.
Nice little Valentine's Day gift there.
Next year we're upping our Valentine's Day.
We
thing.
got you.
Yeah.
Seriously, let's move on to some other news. Enough Valentine's Day news out there, folks. We got Guy Hoggy again. We want to check out with him one more time because he's got a new edition of Pacific Pulse.
Aloha, welcome to Pacific Pulse. A new resolution just passed the Honolulu City Council addressing the inequality of women out in the ocean with regard to surf contests. And joining us to talk about it is Council Member Heidi Tsuneyoshi. Thanks for coming in.
Of course, happy to be here.
Now, this was a very important resolution to make the women more equal with the men with regard to contests in particular, correct?
Right, so specific to the city and county of Honolulu, so Oahu Island specific, is we're looking to change our permitting process in the city for when we permit surfing competitions. The issue is that for a decade, women haven't been able to participate in qualifying competitions that really help them to advance in their career, and now with surfing being an Olympic sport, there needs to be more opportunities for women to participate in these qualifying events.
Yeah, that's right, because there are qualifying events for men to get onto the big circuit, but not for women. They have to travel to do that.
Correct.
Now, have you addressed the WSL? Have they said anything about the situation?
So the WSL did provide comment during the process that we went through when adopting the resolution. And basically they said it is a worthwhile intention of making sure that we address this issue of equity and that women are able to participate, and they just wanted to be able to provide comment, and as the process moves forward, how they feel as well the best way to incorporate women into the current competitions.
Yeah, I think the pushback has been the revenue or the revenue that's not generated by the women when they run their contest. But hopefully they can come up with a better solution for something like that.
Well, at this point in time, too, the women are very workable and want to be a part of the solution. So however it can work out, the North Shore community also has issues of more surfing competition days because of the impact to the community. So they're willing just to have a place in the competitions already at hand and just be incorporated and given the opportunity to participate. So I feel hopeful that we can come to a win-win situation and make sure that everybody's able to have a place at the table.
So that's just the first step you're talking about. So there's a next step, a legislative step after that.
Right. So in the resolution 2012, we had laid out some action item steps so that we had a way moving forward. So one was to set up a committee, and a committee with equal numbers of men and women. So even in the committee, there's gender equity there to discuss a path moving forward. But starting in 2020, to make sure that women have a place in all permit applications, so that if a competition is asking for a permit, that there is a women's division within that competition. And so we're looking to then move forward into a bill to be able to have it as ordinance within the city, so that it's something that's enforceable by law.
And time frame being?
We're looking to come out with that in March, have the first reading of a bill.
Soon.
Right.
All right, well, good luck with that.
Thank you so
and
much.
And keep us posted, because we need to know. It's a very important issue, and we could lead the way in the entire world for something like that.
Correct, yes.
All right.
Thank you so much.
Yeah, Councilmember Heidi Tsuneyoshi, thanks for coming in. Hopefully we see you out in the ocean, out in the beach, surfing the waves.
Oh, that sounds good.
Yeah, and we'll see everybody else out in the Pacific.
All right, we got to get to some breaking news right now. We're taking you live from our vantage point here at the Digital Center. We have a live video feed coming in right now from the Department of Health. They are going to give us an update on the coronavirus. Here we go.
A traveler who was confirmed with the novel coronavirus. Now, many of you know it's being called COVID-19. So when we refer to COVID-19, we're referring to the same virus. After our brief overview, we'll open up the floor to questions. We have a number of people here who are able to answer questions, including Chris Tatum, just in the front row here, and Hilton. Chris is the director of the Hawaii Tourism Authority. Hilton Raythel. Hilton, thank you for coming. He's the Healthcare Association director. Tom Travis is here. Tom, there you go. And Jade, thanks. Dr. Ireland and others. If there are questions, Tom Travis, thank you for coming. And of course, we have Governor David Ige here to open the press conference. So thank you.
Sure. Thank you so much for joining us. We do believe that this is a serious concern, and I just want to assure you that this scenario is exactly what we've been preparing for and are prepared for to respond. I have every confidence that all of our partners, State Department of Health, county, private sector providers, are fully aware, and we do have systems and protocols in place to respond to this situation. All of the state agencies have been preparing for exactly this scenario where someone visits the island and the virus is present. We are taking the necessary actions that we need to ensure the safety of our community. And what we know at this time is that an adult male traveler was in Hawaii from January 28th through February 7th. When he returned to his home in Japan, it was confirmed that he had the COVID-19 virus. So I do want to make it clear that we have not a confirmed case of the COVID virus here in the islands. I know that this raises a concern for all of us. The State Department of Health, Dr. Anderson and his team will provide much more information on this situation. There is still much that we don't know. We're in contact with the Japanese government to do what we would always do, understand where he was, who he might have had contact with, and investigate all of the contacts so that we can assure that there is follow-up and we can assure that that there is no virus. I know that we are ready to address the situation. As I said, this is a situation that we have been preparing for. The county and private sector partners have implemented the procedures and protocols as we expected. We also ask the community to stay informed, to take preventive measures to prevent the spread of respiratory illness, including the flu. Staying at home when you are sick instead of going to work, washing your hands often, covering your cough and sneezes. That is the way that we believe this virus is spread. It's very important, I think, that we all take responsibility for keeping our community safe and limiting the spread of disease in general, and obviously the COVID-19 virus specifically. And with that, Dr. Anderson.
Thank you, Governor. This morning, the Department of Health was notified by the Centers for Disease Control that an adult male traveled from Japan to Maui from January 28th through February 3rd, and then traveled to Oahu from February 3rd to the 7th. He returned to Aichi Prefecture in Japan and developed more serious symptoms there and sought medical care for those symptoms, and was tested when he was there for COVID-19 and found to be positive. During his time on Maui, he did not have any symptoms. He was healthy and well. During the time on Oahu, he did develop cold-like symptoms, some of the preliminary symptoms that you would expect to see with COVID-19, but no fever, which is important. As soon as the Department of Health was notified this morning, we began to gather information and work on tracking any close contacts. That's normal procedures for this situation, and it's those individuals we're most concerned about. As far as we know, the disease is not transmissible unless you become symptomatic, and then you're worried mostly about people who are in close contact with the individual for prolonged periods of time. Fortunately, the individual did not have any symptoms while he was traveling on Maui, and again, he developed cold-like symptoms with no fever when he was here on Oahu. The Department of Health is sending out a medical advisory to all the healthcare providers in the state to be on alert for possible cases. They've been previously notified about the disease, and they're ready and willing and able to attend to anyone who does show signs or symptoms of the disease. And we're also consulting with federal and county partners on the most effective measures to protect our residents and our visitors. We actually have a representative from the Centers for Disease Control with us today that was assigned to help us deal with situations just like this, who is serving as a liaison for us in the federal agencies. because you're going to probably ask this question, I wanted to share with you that when he was on Oahu, he did stay at the Waikiki Inn Hilton Grand Vacation, which is a timeshare in Waikiki. They have been notified about the issue, and they're helping us and cooperating with us and trying to identify any possible close contacts while he was here. We're still gathering information. Obviously, we're learning a lot more about his travel history when he's here, and we'll be able to identify additional situations where there may be a risk of transmitting the disease as we find out more. But we're, of course, focused on this, and we'll continue to investigate this issue until we are sure that there hasn't been any undue exposure to Hawaii residents. Dr. Sarah Parks here, and I'd like her to talk a little bit further about how we're going to be proceeding from this point on, how we're going to be investigating contacts and pursuing this to again be sure that that no one here in Hawaii has been exposed, and if they have, that we take appropriate precautions. Sarah?
Thanks. So as already been outlined, a lot of what we're doing is notifying partners, the medical advisory for our healthcare partners, to make sure that they're alert and aware of the situation, and let us know if they have a patient who, for whom they have no other diagnosis and potentially could be presenting with this disease. However, what should be reassuring is the person was asymptomatic while on Maui and had only respiratory symptoms, cold-like symptoms, and no fever while on Oahu. That's somewhat reassuring to us because we know that when you have the fever, you're probably more likely to be more infectious. However, as a precaution, we are working with the partners to identify potential close contacts, because we know the risk is for those who have that prolonged face-to-face close contact. And so we are consulting with our Japan colleagues. So the Japanese consulate is helping us to track down information as to the exact itinerary of this person. We're also working with CDC colleagues to also try and gather that information, because our focus at this point is to try and understand who potentially this person may have had close, prolonged contact. If you've had fleeting sort of in passing, you passed in the hallway, that is not our focus. Our focus is who this person might have sat down with, had conversation with. Those are the kind of things that we're looking for. Once we identify those persons, then we would make sure those persons would be aware and home monitored, or if the situation requires quarantine. If they do fall ill, that they are appropriately evaluated, and if they fulfill the criteria for testing for this virus, we would do that. So that's what we're doing right now. And I just want to reiterate, the messages that we've been putting out before are especially important now. This hopefully is a reminder and a note for everyone. This is why we practice the infection prevention measures we've been talking about. Washing your hands. Washing hands is important because we touch our face often. We want to make sure if we touch our face, which we should try to avoid doing, that it's with washed hands, not an unwashed hand. And also, if you do become ill, stay home. Do not get on the bus. Do not go to school. Do not go to work. Don't go to a concert. Please stay home if you're sick until you recover. And everyone, please take care of yourself, because having good health to begin with when you have infection it goes a long way in recovery, making an eventual recovery. So with that, I'll close.
Just make a couple of closing remarks, and then we'll take some questions. So I wanted to emphasize that the department is committed to sharing information as it becomes available, and we will do so. We urge people not to spread misinformation or inaccurate information that's not confirmed, but please keep updated on what's happening here. We get dozens of calls of rumors and other information every day, and it's important in this situation to check your sources and be sure that the information that you're hearing is accurate. I would also like to remind people to take basic precautions and stay at home when you're sick. Don't go to work. Wash your hands often. Cover your mouth when you cough and sneeze. Stay away from others when you're ill, and I would certainly avoid any school or other social gatherings. And we can prevent a lot of illness if we follow these steps, even the flu, which is a big problem in our community today. With that, let me close the formal part of the presentations here, and we'll try to entertain any questions. Again, we have Chris Tatum with us, Jay Boutte, who's the Department of Transportation, Hilton Rethel, and Tom Travis, all here to answer questions about issues they may be able to help with.
Bruce, is there any confirmation that this person now in Japan went to a health facility or medical facility in Hawaii?
No. As far as we know, he didn't seek medical care when he was here. He did, however, go to a hospital in Japan when he returned, and he did develop significantly serious symptoms when he was there. I won't go into any detail on that, but that's how they identified the individuals having been infected. Again, he did not seek medical care, as far as we know, when he was here in Hawaii.
Because he was here for 11 days, is it possible that he was able to contract the disease when he was still in Japan before he came to Hawaii, or is it usually he contracted while he was here?
So the assumption is, because he became symptomatic during his travel here on February 3rd, that he most likely was infected while in Japan or potentially in transit here, and then was diagnosed when he returned to Japan. Does that answer your question?
So he was while in Japan?
He was probably infected in Japan or while traveling here.
Let me just refresh your memories then. So the incubation period is somewhere between 2 and 14 days. Some think it may be even longer than that. And if you look at the time frame here when he actually started developing symptoms, which is probably somewhere around March 3rd.
February 3rd.
Go back to February 3rd. I have a hard time with that.
Wait, can you finish the question first?
It's a very good question. Let me speak to that for a moment here. So the individual developed symptoms on or about February 3rd, and based on what we know about the incubation period for the disease, it's very likely the individual was exposed in Japan or in transit coming to Hawaii and became sick when he was here. This is how most cases in the United States are being identified. After someone's been exposed, and when they get home, they develop the symptoms. Here, the person was traveling and developed the symptoms to begin with, at least in Hawaii. But again, all the evidence we have is that he was infected when he was in Japan or in transit to Hawaii. We'll know more as we get more information, but it's probably never going to be certain as to where the individual was exposed. But the best evidence we have suggests that he was infected while he was in Japan before he came to Hawaii. So your question?
Sorry about that. Do you know if he was with anyone closely while he was here, like in the same room during his stay?
He was traveling with his wife, and obviously that would be a contact that we'd be concerned about. As far as we know, his wife is still with him in Japan, is no longer here.
She's okay.
We have no information on any other travelers. We only have information on this particular traveler, and again, as I said, we're still investigating. We do not know about any other close contacts, and that is the focus of our investigation.
What can you share with us as far as his exact itinerary at this time? What towns he travels?
We have very limited information. All we know are what we've actually provided to you. We know he was in Maui at the start. He was asymptomatic, and our focus really is on his whereabouts while he was on Oahu, because that's when he developed symptoms.
So part of the protocol is to work with the government in Japan and find out what his specific itinerary was while in the islands, and evaluate and identify any potential contacts, and then the department would follow up with those people. So you know exactly what we know at this point in time. We're committed to keeping you informed of what we know. As we get more information about his specific itinerary or places that he visited, then we will examine that and identify any of those workers that might have been exposed that we might want to contact and make sure that they follow proper hygiene and can stay connected with their medical providers.
So let me just add to that, because you may ask this question. So what do we do if we find a close contact? Is probably the question you're thinking. If we find a close contact, obviously his wife would be a close contact, but others who were in close contact for prolonged periods, we would implement the same process that we typically do, which is to restrict that individual and isolate them in their home or in their lodging, wherever they may be, for a period of 14 days, so that they are not at risk of transmitting the disease to somebody else. Again, that would be only for the close contacts. For people who are casually exposed, say happen to be walking in the same room or walking nearby, we would not consider them to be at increased risk. That's go ahead.
The investigation is ongoing, and so you can imagine that there are details that we still do not have, and this is why it's important we're asking you for help in letting our community know, practice the infection prevention measures, because by the time we identify a potential risk, several days, frankly, may have gone by. So it is important for people to monitor their health, to be aware of washing their hands and avoid touching their face with unwashed hands, and to stay home while they're sick. So we're asking for the community's help, for all of you to be aware, and so that when we do identify potential at-risk individuals, they'll have already been practicing those things to minimize potential risk to others. So that's what we're asking for, everyone to have that increased awareness at this time.
So didn't the CDC report yesterday that even if you're asymptomatic, you can still transmit the virus?
I don't believe they said that specifically. I know they have said that the role of asymptomatic transmission has still not been entirely clarified, that it is felt that it does not play as a primary role as being symptomatic. So the focus, as I understand it, and I'm sure my other colleagues in other jurisdictions understand it, we're focusing on symptomatic individuals.
I think, when I was in Washington, D.C., and we did get a briefing by the CDC and Department of Health and Human Services, they made it very clear that this is a new virus and there is much more that we don't know. They're making assumptions because it is a coronavirus, that it behaves like other similar viruses. So even the incubation period is based on more what other viruses have been rather than specific information. So we are taking what we know and applying it in the best way that we can.
Let me also add that although we don't know everything about the disease, we do know that every case that occurred in the United States had exposure to China or to other symptomatic individuals, a husband, wife, or whatever the case may be. So from the evidence we do have, the only people that are transmitting disease are people who are symptomatic.
Sorry, Bruce, but Japan has a couple of cases that had no exposure to China and somehow got the virus.
Well, again, I'll ask Dr. Park to answer that question.
So that is a question that I think partly has to be answered by our federal colleagues, the Centers for Disease Control and Prevention, in that they are monitoring what is going on internationally and notifying us and other jurisdictions about that. But there is growing concern about potential for community transmission occurring in other jurisdictions. Remember that the World Health Organization has announced to all countries to consider the fact and be prepared for the fact that this virus may now expand beyond the borders of China. So that is a potential concern. It just goes back to, again, the importance of the infection prevention measures. Wash your hands. Do not touch your face with unwashed hands. Stay home when you're sick. Cover your cough and your sneeze. I can't emphasize enough how important that is right now.
Dr. Park, I was able to speak with a 70-year-old Hawaii man who was on that ship and is now in the Japan hospital recovering. He is on the road to recovery.
I'm glad to hear that.
He said that he was tested on the ship on February 8th and then confirmed for the coronavirus on February 11th. So there was a few days there where he was in close quarters on that ship with the virus potentially. Do you have any concerns that Hawaii residents who are on that ship and now being treated in Japan are getting the best care and getting immediate care?
So what's happening in Japan is a concern that I have to defer to our federal colleagues. My focus is on what is going on in this state. Of course, I'm very concerned about our residents outside our borders, but our focus is here, and we depend on our federal colleagues, the Centers for Disease Control and Prevention, to ensure that not just Hawaii residents, but all U.S. citizens are appropriately cared for.
What will be the protocol once the 70-year-old man has recovered and then returns to Hawaii? Will he have to go through some sort of 2-week quarantine when he gets back?
So he's already sick and confirmed, so he's in a different category, essentially. He has the virus. So he will most likely not be released until the Japanese authorities and or U.S. authorities in collaboration decide that he is no longer poses a direct risk to the public. So I'm assuming we will be notified if there is a concern for Hawaii. If there's no concern for Hawaii, I honestly do not expect them to let us know. That is a private matter then for the family.
Let me add, we've talked about the scenario. We've talked about the scenario of passengers from that cruise ship coming back to Hawaii and how we'd handle those. And again, here we would resolve uncertainties in favor of protecting public health. We would be looking at a continued quarantine period for those individuals of 14 days when they arrived here, just to be sure that they weren't transmitting disease. This is a home quarantine or quarantine in their lodging, but we felt that was prudent, not knowing when they might have been infected on that vessel. It could be just before they left. So it's not every case is going to be handled on a case-by-case basis, but as it is, we would be looking for an additional quarantine period for those who are asymptomatic but may have been exposed on the vessel.
This may be a question for Hilton, but what are the hotels doing to protect their workers? Yes.
Not Hilton. Chris.
Chris. You can answer that. Why don't you share here?
So, you know, every organization has its own protocol, and as soon as the health department was aware of it, they informed the hotel or the timeshare, and I actually reached out to them and talked to them too. They're taking direction from the health department, but they're in the process, and you probably need to reach out to them to see exactly what they're doing. Every organization has it a little differently, but they're really focused on protecting their visitors and their associates. So I would reach out to them for the details.
Chris, what can you tell the union members? I know that this might be a different question for you, but what can you tell the union members? Because we've heard from them. We know the lieutenant governor met with union members earlier this week, and they're very concerned about their employees going into hotel rooms and cleaning rooms. So what can you say?
You know, I would say that the experience I have and the interactions I've had with the hotel industry and the management teams is they're as focused on all their associates and the visitors. So the expectations are going to keep them well informed and follow the direction from the health department on what's the best way to protect them. That's the feedback I've gotten.
The only class of workers that we feel are at increased risk from this virus are the healthcare workers. All the others, we'd recommend take their normal precautions. Maintenance workers who have safety devices, gloves, and so forth should continue to wear those. But there are no special requirements for individuals with that may be exposed to this virus. It's not thought to impact any particular occupation, including, by the way, airlines, flight attendants, and others, in any special way. But healthcare workers are being advised to be careful and wear their protective equipment when they are working with patients.
As far as this man from Japan, what airline did you fly? And when you investigate close contact, do you look into contacts at the airport as well as the plane?
So at this time, we are still pending the flight information, and again, we are working with CDC colleagues and the Japanese consulate on that, securing that information. We do know he was wearing a mask, so that is helpful. Masks, surgical masks, by the way, are helpful when you are sick to prevent you from infecting others. So we have been advised that he was, while traveling, wearing a mask. So that is good news to hear, because it does minimize risk to other travelers. But we are pending that information at this time, and we would be working with our CDC colleagues to potentially identify at-risk travelers.
Why are you pending that information?
Because we've only been just notified. You've not given me time to look at my emails, so thank you.
When you find out the flight and the airline, would you release that information?
So the way it works, as you might imagine, there have been a number of individuals who've traveled by now, especially from China. And what happens is CDC, Global Migration and Quarantine, gets the information, notifies the jurisdictions when there are travelers that potentially are at risk. It's our job to get in touch with the traveler to let them know potentially that what their risk was, and then to put them into home monitoring, our home monitoring program. So as Dr. Anderson has already described, so that is how the process works right now.
Sorry, everyone, we just have time for one or two more questions, and then we
So, Dr. Park, with all the flu cases going on, and this is similar to
Yes.
the symptoms, how are you going to differentiate who has that
That's a
virus
great,
versus the
no,
flu?
that's a very good question. It's definitely a concern, not just here in Hawaii, but nationally, internationally, because there is a heavy flu season ongoing, especially on the mainland. It is why our medical advisory reminds our healthcare providers, don't forget that common things are common, and that we do need to make sure that before we sound off all the alarms, we need to make sure the regular flu test is done, if not the entire, looking for other more likely etiologies, because that is still going to be more common, more likely than this novel coronavirus.
Can we get an update on the test kits? We saw some reports that they've been flawed or that things are not going well with them. Any update?
The information we have at this point from our CDC colleagues is that they're busy right now reformulating a portion of that kit that was flawed, and their plans are to send that new kit out to all public health labs in the next week. That's the information that we have at this time.
I certainly had the opportunity to talk with the CDC and explain why, from being in Hawaii because of our isolation, the other states were surprised to learn that for us, because we have to ship it back to Georgia and back, that it would take a week or more to get results, and they recognize that Hawaii is a different situation, and they are definitely focused on getting us valid test kits as soon as possible. They recognize that the state having the capability to test in-state greatly accelerates our ability to identify the virus and then take appropriate action.
Governor, Senator Schatz is asking for more money to deal with this.
Yes. So I had the opportunity to speak with Senator Schatz and Senator Hirono, and we exchanged information. They obviously were briefed by the federal counterparts as well. So we all made it very clear about the situation in Hawaii. He is pursuing additional resources from the federal government side to make sure that the response team at the CDC and all the way down through the food chain has the resources they need to appropriately respond to the situation.
Is there an actual budget for this that the state has for now?
Well, not at this point, not that I'm aware of. I mean, obviously, the state and the local partners are acting within the budgets. Obviously, it's a priority to make sure that we're well-resourced. I don't believe that resource is an issue at this point in time anywhere to the state. We understand that this situation can become very a big concern, and so we want to make sure that the resource is not an issue in the response at this time.
Let me just verify that. We believe we have the resources necessary to deal with this situation. If things change dramatically and we start seeing hundreds of cases, that may change. But the Division of Outbreak Disease Control is well staffed with expert epidemiologists, and I believe we are in a good position to chase down contacts and so forth. Our laboratory is one of the best in the Pacific area, so they are able to run the PCR test that we will be receiving, and there isn't any additional cost associated with that at this point in time. So as it is, I think we're in a good position to respond. And if we do need additional funds, those are also available.
Okay, so we need to wrap this up. I'm sorry.
Janice, this is obviously going to be an evolving situation. Do you have any advice on those who are here on who should contact to get additional information?
Oh, they can contact me, email me, janice.okubo@voh.hawaii.gov. So just go ahead and email me your questions or,
All right. You heard it there, the breaking news of the hour. The governor announced a Japanese visitor visiting recently here from Japan confirmed to have contracted the coronavirus. I'm bringing in now Daryl Huff, our managing editor, sort of recap us on what we've learned there.
Okay, well, there's quite a bit of news in this press conference. The most significant is what you mentioned, that an individual, a man from Japan who has apparently never been to China, was in Hawaii through January and part of February. He was symptomatic of something, a cold maybe. He actually went to see a doctor or a clinic while he was here, and then he traveled back to Japan wearing a mask, but they emphasizing he was wearing a mask while traveling, and that was good news. And that when he got back to Japan, about a week after he got back to Japan, which is yesterday, he was diagnosed, confirmed with the coronavirus. There's so much we don't know about this disease, right? So we don't know the exact timeline of it.
We did learn two very important things. He traveled to two different islands, right?
That's right. Oahu and Maui. On Oahu, and I think it's very significant and sort of heartening that the health department actually did reveal the hotel that he was at, which I want to make sure I say it correctly. It's the Hilton Waikikian Gateway. Hilton Grand Waikikian Gateway.
Yes, and I'll just double check that to make sure we have it right.
Yes, it was mentioned, and then only once did they drop that important information.
And just to clarify, it's the Grand Waikikian by Hilton Grand Vacation. So that's a timeshare spot, very popular in Waikiki.
Right, and so the mere fact that they actually named this hotel is kind of a new level of openness by our health department. In the past, when we had dengue fever and that sort of thing, you'd see these teams of people going out in the white suits, attacking an area, and you'd call and say, is there a case in that area? And say, oh, no, we can't say, with medical privacy. So that's significant. Also in the last 24 hours, 2 Hawaii residents who are now in Japan that were on the cruise ship.
Yeah, we just heard from him from Mahealani's interview. We're going to have more on that tonight at 5 and 6,
That's
too.
right. We learned about one of those cases from the family and the other through Lieutenant Governor Josh Green, who was noticeably absent at this press conference. I mentioned he had a luncheon speech or something.
Yeah, we heard from him at the top of the newscast in a taped interview. He did not reference this because obviously it hadn't been confirmed yet.
And so what's very important is that the health department tracked down this guy's exact itinerary, the Japanese man's itinerary, because obviously he flew here on an airplane. He flew between Maui and Oahu on an airplane. He flew back to Japan, and they don't have his flight itineraries yet. So if you think you may have been on one of those flights, who knows, you're going to be a little bit concerned. But transmission, they're saying, casually is not that easy with this disease, but they don't really know for sure. So all these unknowns make it very kind of spooky, but then they keep reminding us there's also flu. So if you're protecting yourself against the flu, you could probably protect yourself against this.
Yeah, and they emphasize that. Take your normal precautions. Wash your hands. And they also said they're looking for people with close contact, which is sort of vague to me because they also said those hotel workers who work there should go about their daily business.
Right. So, like, if you're I understand what they're saying there. This is a protocol that they do with any of these outbreaks.
Yeah, they were referencing more like his wife, his family.
They go in concentric circles out. Each one is less of a concern. So they start with the immediate, then they go a little bit out, a little bit out. The maid that was doing his room, for example, might be found. And the way these hotels are organized, they will know.
Yeah.
Pretty close, within 2 or 3 staff who had contact. But now you're talking about restaurants and elevators and a lot of potential
How many places you go on vacation? You're there to see everything.
Yeah, so, at this point, we shouldn't be surprised if other cases pop up.
Now, that's what I was going to ask you next. This is the new phase of this outbreak
for Hawaii,
in our state.
Yes.
And for the country, really. I mean,
no, I think they've had contact. They've had interpersonal contact.
A Japanese
infections
visitor there.
in the mainland.
Yes.
But yeah, for us, this was kind of. I mean, I don't want to say worst case scenario because in fact, he may have been wearing a mask all the time he was sick. You know, and he how do I put this?
Well, like she said, we have so much to learn still.
Right.
She's pulling up her phone during a press conference, Dr. Sarah Park, saying, I haven't even read all my emails yet.
Yeah,
about
this report popped out of 2 Japanese media, and we had it quite early this morning, but we're literally using Google Translate to figure out
Yeah, and that's why we
what
didn't
this
run
is
with
saying.
it at the top
we,
of the newscast.
we held on to it
because
because we didn't want people to panic, and people still shouldn't panic.
And that's what they're stressing there as well.
Yeah, absolutely. You know, but in terms of Hawaii as a tourist destination, close to Asia, this was probably going to happen. The big thing here, though, that I didn't hear a lot of discussion about is our information was this guy didn't go to China.
Yeah, as far
so
as they
where
know
did he get
right
it?
now.
Did he catch it in Japan and ended up flying over, or did he get it here? If he
a-
got it here, that's pretty significant.
Yeah, and of course we're going to ask a lot more questions. We have 2 reporters at that news conference right there. They're following up with even more questions with those officials you just heard from. We're going to keep tracking this all morning, a very major development in the coronavirus outbreak. Stay with Hawaii News Now. We'll bring you the very latest as it comes in. Until then, thank you for watching. This is Now.
Thank you, Jonathan.